Thank you so much for joining us. I'm Jeff Vaughn.
And I'm Lena Wynn. Another vote, another loss for Republicans in the U.S. Senate who are desperately trying to change or eliminate Obamacare. Yeah, for the second day in a row, Republicans failed to get enough votes to overturn the health care law, but they aren't done trying. KCAL9 political reporter Dave Bryan has details of the latest defeat. Dave?
Not done trying, but their options are really getting pretty narrow at this point. The fight goes on for the Republican leadership in the Senate, but their options tonight appear to be whittling down to one. The Senate has now rejected a major replacement health care plan and a repeal plan, and now it looks like the Hail Mary is called skinny reform, but its contents are still a tightly held secret right now.
On this vote, the yeas are 10. The nays are 90.
On a day when a flurry of proposed health care amendments and a plan to repeal Obamacare and fix it later were blown away by a coalition of Democrats and some moderate Republicans, the Senate appeared to be spinning its wheels with nothing being accomplished and the summer recess looming straight ahead.
The motion is not agreed to.
The most significant rejection was on the bill to repeal now and replace later. With 7 Republicans defecting, the bill fell short. Here's what one of the Republican no voters said about it.
I didn't think repeal only was appropriate because it doesn't provide that help for those people. They're stuck in the status quo.
Clearly, the Senate bill, repeal and replace, has failed. Senator Paul's bill, repeal without replace, has also failed.
Democrats have been united against all of the Republican plans, each of which they charge would leave millions of Americans who now have health coverage without it. But Republican supporters of repeal and replace, like Louisiana Senator Bill Cassidy, a physician who worked for 25 years in public hospitals in his state, says his party is doing exactly what the American people want them to do.
We are struggling right now to find a replacement for the Affordable Care Act. The American people have voted in 4 successive elections for such a replacement. You can ask yourself, if the Affordable Care Act is so great, why would the American people continue to want to have a different program?
So what will the Republicans do now? Well, Senate Majority Leader Mitch McConnell is actually talking about reaching across the aisle.
I know members in both parties have health care ideas they'd like to offer. If you've got one, bring it to the floor.
But with the first 2 options already having crashed and burned, the final action may be a so-called skinny repeal, which would reportedly knock out Obamacare mandates that most Americans either subscribe to a plan or pay a penalty, and it would eliminate some of the taxes. But the Democrats say they'll continue to vote no unless and until they actually see exactly what this skinny repeal would do.
That under such a plan, as reported in the press, 16 million Americans would lose their health insurance, and millions more would pay a 20% increase in their premiums.
In the meantime, President Trump took his Twitter revenge against Alaska Republican Senator Lisa Murkowski, who voted against even starting the debate on the Obamacare replacement without having a clear plan. The president tweeted that she really let the Republicans and our country down. Her reaction to the president's tweet?
If I were to focus on every little morsel that comes out every day, I wouldn't have time to do the job that I need to do.
Now, the incoming fire on the Republican repeal and replace plans is also coming from outside Washington. The New York Times reporting that 10 governors this evening from both parties signed a letter urging the Senate to reject a skinny repeal measure. And the Blue Cross Blue Shield Association, that's a big insurance organization, warned the Senate today that repealing that mandate that most people must have health coverage could be disastrous. The association declaring that allowing people to purchase health coverage only when they need it would drive up costs for everyone and by a large margin, Jeff.
Okay, Dave, and on top of all that, I understand we have some late developments related to the new communications director, Anthony Scaramucci.
Yeah, just coming in this evening now, this information is Scaramucci just tweeted he's calling the FBI to investigate a leak of his own personal financial information. It came right after Politico reported that Scaramucci has ties to his old hedge fund and still makes millions from the firm. Scaramucci called that a leak. The Politico reporter who wrote the piece just responded, tweeting he got the information from a public document filed with the Government Ethics Office. Jeff, Lena?